All right, guys, welcome back to Underground Science. In this video, we'll be talking about severe combined immunodeficiency. Okay, so let's go and get started. So we can just jump into the findings right away, right? So in this disease, of course, you're immunodeficient, right? So let's start with the first finding, see how that works and what that leads to. So what you can find in this disease, right, in patients with severe combined immunodeficiency, one of the findings can be an adenosine deaminase deficiency. Okay, so let's go and see how that works. So remember from our purine salvage pathway, we had adenine, right? And if you remember, we said that adenine can get converted into adenosine monophosphate via adenine phosphoribosyl transferase. And we said adenosine monophosphate, right? Because this is important for recycling too, right? So you can convert adenosine monophosphate to adenosine and then back to adenine, right? Adenine. So you can recycle adenine. But what also happens, part of the salvage pathway, right, is that adenosine can get converted to inosine. Okay, and remember, inosine can then go on to form hypoxanthine, hypoxanthine to xanthine, and xanthine to uric acid. But we need this conversion to happen, right? So we don't have a buildup of adenosine. But to do this conversion from adenosine to inosine, you need adenosine deaminase. Okay, you need adenosine deaminase. In people with severe combined immunodeficiency, you can find an adenosine deaminase deficiency. So we no longer have that. You can't convert adenosine to inosine. So adenosine starts to build up a lot. Okay. Now, a lot of adenosine is toxic. Okay. To what? Right? It's toxic to your lymphocytes. It can actually destroy your B lymphocytes. So you're going to have very low number of B lymphocytes. It can destroy your T lymphocytes. So you're going to have a low number of T lymphocytes. And it can destroy your natural killer cell. So you have a low number of natural killer cells. Now, something else that can happen, if you have a toxic buildup of adenosine, a lot of this adenosine can then start getting converted into deoxyadenosine. Okay. Now, deoxyadenosine in high amounts, what it actually does is, if we remember from the video where we were talking about synthesis, right, of different purines and pyrimidines and all that, we said deoxyadenosine in high amounts, what it actually does is it can inhibit ribonucleotide reductase. Remember, this enzyme is important for DNA synthesis, right? Ribonucleotide reductase. So if this enzyme is important for DNA synthesis, right? And if we're inhibiting this enzyme because of increased levels of deoxyadenosine, that means we won't be able to properly synthesize DNA. That means your lymphocytes, right, won't be able to proliferate properly. And that can lead to, again, low number of lymphocytes and further contribute to the immunodeficiency seen. Okay. So that's adenosine deaminase deficiency, and that's how we can lead to immunodeficiency, low B lymphocytes and T lymphocytes, and natural killer cells. Now, the next finding is easy to remember, right? Because if we talk about adenosine deaminase deficiency, we know that destroys your B lymphocytes and T lymphocytes. So it makes sense you're going to have a low B lymphocyte count and a low T lymphocyte count, as well as a low natural killer cell count, as we've discussed, right? Due to the buildup of adenosine. Again, the next finding makes sense too, because if you have a low B lymphocyte count, then you know we're going to have low antibody production, right? Because B lymphocytes produce immunoglobulins. So if we can expect low immunoglobulins, which is called hypogammaglobulinemia. Even the next finding makes sense too, based on the previous findings. If we have low B lymphocytes, low T lymphocytes, low natural killer cells, low immunoglobulins, then we can expect recurrent infections, right? So the first four findings make sense. Now, a finding we can commit to memory is cytokine receptor defects. And the reason this is bad is if you have cytokine receptor defects, right, this can affect certain cytokines. So it can affect cytokine signaling. And what are those cytokines that it can affect? So certain cytokines that can get affected due to cytokine receptor defects are interleukin 2, which is important for T cell proliferation, right? Interleukin 4, which is important for B cells, right, to switch to class switch. to certain immunoglobulins like IgE, for example, and IgG, interleukin 7, right? Interleukin 15, even interleukin 21, all of these cytokines will be affected in terms of their function. So they won't be able to function that well. So think about that, right? If interleukin 2 is not functioning, you can't properly proliferate your T cells. If interleukin 4 is not functioning, you can't properly make your B cells produce certain antibodies like IgG and IgE. Interleukin 7 turns out is really important for T cell survival. Okay. But if interleukin 7 is not working properly due to cytokine receptor defects, right, then T cells won't be able to survive, leading to a low T cell count. Interleukin 15 is another thing that we can talk about. It turns out interleukin 15 is really important for the survival of natural killer cells, okay, and the development, I should say, of natural killer cells. So if natural killer cells aren't developing properly, they won't be functioning properly. So that can also contribute to recurrent infections and whatnot. Okay, so we can really see that this severe combined immunodeficiency, hence the name, right, affects your immune system at great lengths. Now, something else to talk about is if you don't have many lymphocytes, don't have many immunoglobulin production, right, much immunoglobulin production, you don't have many T lymphocytes, like remember your lymph nodes, right? The paracortex of your lymph node houses your T cells, and we know the cortex, right, houses your B cells, and we know that we have our primary and secondary follicles, right, in our cortex, where we form germinal centers, right, via B cells, right? So we know that we go somatic hypermutation and whatnot, right? So the B cells are important in the cortex area of your lymph nodes. T cells are important, and the paracortex house your T cells in your lymph nodes. But if you don't have many B cells or T cells because of this, you're very severely immunodeficient. Of course, you can expect to see underdeveloped lymph nodes, underdeveloped and tonsils, right? Even an absent shadow on of your thymus, right? So your thymus won't be developing properly. So you can see underdeveloped thymus because remember, that's where your T cells mature, but you don't have T cells to begin with or enough T cells. So you can expect to see an underdeveloped thymus, right? Or an absent shadow when looking at the thymus. So that makes sense, right? Because tonsils have lymphoid tissue too. But if your immune system is, barely functioning and you don't have many immune cells, you can expect to see underdeveloped tonsils also. And the last thing we should talk about, another finding you can see in severe combined immunodeficiency is a deficiency in your MHC class 2. Now remember, your macrophages, dendritic cells, B cells, right, can take certain pathogens, break it up, and present it onto MHC class 2. To who, right? To T cells. This can activate your T cells, which then go on and activate your B cells to produce antibodies, right? But if your MHC class 2 isn't working because you're deficient in it, you don't have many MHC class 2 molecules, which means not many T cells can get activated, which means not many B cells can get activated. Okay, so that's something we see too. Anything that's going to affect the T cells will affect the B cells. So, for example, interleukin 7, we said is important for T cell survival. If you have a cytokine receptor defect, right, then you won't have proper functional interleukin 7, right? Interleukin 7 won't be able to do its job, which means T cell survival won't be much. You'll have low number of T cells. Low T cells means you can't activate B cells properly, which means you'll have low functional B cells and low immunoglobulin production. Okay, so it's important to know if it's affecting your T cells, it's going to affect the B cells because T cells need to activate your B cells through cytokine release in order to have class switching, right? Like interleukin 4 and 5 is important for that. So your B cells can actually secrete antibodies like IgE, A, right, and IgG. Okay, so that's actually those are the basic findings that I wanted to discuss for severe combined immunodeficiency. Right. So, a clue could be if you see a statement like absence of lymph nodes and tonsils in a child with a recurrent infection and failure to thrive, right? You can also keep severe combined immunodeficiency in mind. Okay. So that's it for this video. I hope this video wasn't too confusing. I hope this video helped a little bit. And thank you guys for watching and see you guys in my future videos.